So let's talk about prognosis. It's a challenging topic, but it's important that we address it.
Yeah, I think it's a really challenging topic because it raises questions and thoughts that we don't often like to think about. Um, and also because there is a lot of variability in breast cancer. So, if we look at someone with stage 4 pancreas cancer, there isn't that much variability, unfortunately. And so when people are given a prognosis, doesn't it's not that different from one person to another. And I think one of the things that gives me hope about breast cancer, but is very hard with breast cancer, is that there is a lot of variability. And there are people with brain mets who survive 10 years. I mean, they really are. I take care of some people who are 10 years out with a diagnosis of brain mets, and they're doing very well. And there are people who die within 6 months of the diagnosis of brain mets. And so when you give an average, you're averaging those two sets of people. And it's very different to be thinking that you have less than 6 months versus you have 10 years, right? Um, and and how do you communicate that with patients, and how do you think about it as somebody who's living with cancer in the brain? I think that's really hard. And then the other, the advice I do give to patients though is that when you hear median survival or average survival or prognosis, usually when people ask about prognosis, they're asking about what's the average survival. That's how we answer the question. But it's not a cliff. So everyone thinks like if you're told 6 months, if you're told 2 years, if you're told for whatever time that is, it feels like there's a cliff and you're going to get to that point and you're going to fall off the cliff. And unfortunately, some people don't make it to the average, and a decent number of people make it beyond, because the way that we give our numbers is half the people don't make it to that point and half the people make it beyond. Like 50% of people make it beyond the average that you're being told. So I think, again, that's one of the tricky parts about breast cancer. I do think that if you're ready to hear about prognosis, it's a good thing to ask your doctor. Because I think, when you're planning your life and the things that you want to prioritize and what you want to spend time doing, it is helpful to have some sense of what the range might be. And I think that might be a more useful way to think about it is, what's not the average, but what's the range? Like, what's kind of the average scenario? What will be the best case scenario? What will be the worst case scenario? Unfortunately, there are people who I take care of, and the best case scenario is a couple months. There are people who have really bad disease, but there are also people I take care of, and the best case scenario is years. And I think if you are somebody who's ready to hear that information, it's a good thing to talk with your doctor about. If you don't feel comfortable talking with your doctor, sometimes you'll work with a nurse practitioner or a physician's assistant. You could start with them first, and I think that over time, people are ready for different things too.
I agree that it definitely changes with time, and that communicating to your doctor how much information you want, in order to be able to prepare, or for me personally, understanding that I'm preparing for this long but expecting and hoping for this long. But I think it's important for patients to remember that it is an average, and that what you just said is so spot on, that you're averaging together very variable prognosis of life. And that I try to tell people, just in the end, remember that you aren't that statistic. Really, no one is that statistic,
Yeah,
because it's an average.
right. I
So,
think
but
where we become more accurate is when things, really accelerate at the end. So when it comes down to someone having less than 3 months, are we perfectly accurate? No, of course not. We are. I'm still surprised sometimes, and with how quickly things can go. But usually if somebody has less than 3 months, we have that we're fairly accurate about.
Yeah.
And that's where if it if a patient hasn't brought it up proactively, I'll start to, when things turn like that, I'm going to start to bring it up proactively because I just think it's important when people make decisions about next steps to weigh that. But the reality is I'm not very good at predicting 2 years versus 5 years. Actually, not at all. And so, I think we just have to be honest about our limitations, about what we can predict and what we are not so sure about, especially as the treatments keep changing over time.
Yeah, I mean, that's something to consider. I mean, from my own perspective, when I entered into the brain meds world, one of the drugs that helped me the most didn't technically exist.
Right.
We were looking at averages without that drug, and then for it to enter, it totally changed the game for me personally. And so you never know what's coming up next. And the research is moving in the right direction for those with brain mets.
Right.
So that kind of leads into being hopeful. And while nobody here, me, is telling anybody to be, positive or Pollyanna about this, because it's very challenging. But there are cases of, I mean, I think it's important to highlight some cases of hope, and you have some of those to share, I think.
I do. So, I mean, I can tell you a few stories. I'm going to change. I'm not going to tell any big names. I'm not going to put any dates on it, just to keep things confidential. But these are real people. Um, there's a person that I care for who was diagnosed actually now over 15 years ago with her brain mets, and received radiation treatment as was standard of care. She's like one of the lucky ones. Like, I can't explain why she has done the way she is. There's nothing about her that's different than many other people I take care of, other than she has HER2 positive breast cancer. But now, all these years later, she's on Herceptin IV, and she's had no progression of her cancer anywhere. Um, and it's not like I had anything to do with it, right? It's just it's I mean, we do see these people who have what we call exceptional responses, um, and it doesn't happen like all the time, but it's not like 1 in a million either. So I think, for her too, we are seeing people sometimes who live for years after a diagnosis. But, I think this is where how things evolve over time is something we can't predict, right? So I couldn't have predicted when she first had brain mets that nothing was going to happen in such a long time. Um, I wouldn't have been surprised if something had happened, a year into her brain met diagnosis that we needed to treat again or whatever it is. So, but, again, if you ask pretty much any oncologist who takes care of breast cancer patients as their primary specialty, they'll be able to name you people who are like this person. I also know of a person with triple negative breast cancer who, because she had so much disease actually in her liver, and only a little bit of disease in her brain, her doctor decided to treat her with chemotherapy, um, and then deal with potential radiation to her brain after hopefully her liver responded to her chemo. And when she had her repeat scans, actually both the cancer in her brain and her liver had gotten better. And she actually stayed on that treatment for a period of time. And then she again is like, really, I mean, I'm not saying that everybody's like this. These are exceptional patients, but she had to come off treatment because of problems with her blood counts. She was off of all treatment for 2 years, and that's incredible. So again, these are not common situations, but I think that, and I want to be really careful not to,
Right.
overpromise. but I do know from doing this for a long time that people surprise me all the time.
Yeah.
And and you, Leanne, I mean, I don't know how much you want to share about your story, but I mean,
Mind sharing. Yeah.
you are, certainly beyond the average survival.
Yeah.
And we've treated you with a variety of regimens, not all of which are necessarily the usual strategy. And again, you can cut this out if you don't want.
No, I don't mind sharing at all. I
But,
felt.
I think the frustrating part has always been like the location, right? Because if your brain med had been anywhere else, like you would be even that much better. And again, like when I first met you, when your other doctors first met you, I mean, none of us would have promised that you would get to this point at all. But
Yeah.
we would have told you that it's not impossible that you could get to this point, and that we see other people get to this point, and you have. And I think, um, I mean, to me, I think that's one of the most important parts about the research is like, not to give up on patients, and I don't mean this in a way like when it's time. I am all for hospice. I'm very honest with patients, and I will tell people when I think it's time. Like I believe very strongly in honesty. um, but it's also true that I think it's important to share the patients who've done far better than we expected, because they are not rare. And because when we see patients like that, we know what's possible. Like you can start to see what's possible, and you like want it for more people.
Yeah. I mean, when I was first diagnosed, for those who are watching, I was diagnosed with brain mets only. So it was unusual, and it was my first site, and there was a number of them. So I think it was for those meeting me, you and other oncologists, it didn't necessarily, I think, look good from a standpoint of like, she just finished early stage, it has now progressed to her brain and her brain only. But then here I am 5 years later. And while I prepared for a year, maybe two, I never let myself stop thinking that longer was possible. And, I've fallen into that category of things being lucky or whatever you want to call it. But I think that comes back to it's important to remind yourself just that you aren't a statistic and to take it day by day as best that you can.
I agree. And I think when you talk to your doctor about your prognosis, or when you go online and you research, which I do think is a good thing to do. I mean, I think there's a lot of information you can get online. I'm not somebody who tells people like don't go online. But I think that where your doctor can come in is saying for you specifically, what do they think? Because, your doctor knows what treatments you've gotten before, how many spots are in your brain, where they're located, what the pace has been. There's like all these factors that really are not captured. I mean, in the average, it's just everybody, right? And so I think when you're talking about prognosis, I do think it's important to ask your doctor, like for me specifically, what do you think? And you know that you're not going to be able to have a crystal ball, and you know it's not going to be perfect. And you might ask for a range rather than like this is the average. But I think, and I think it's totally fair to ask, have you seen people go longer than that? I think that's a totally fair question. And if you're ready to hear the answer to that question.
Yeah, me is so important to have an open dialogue with your doctor throughout all of your metastatic treatment, regardless of whether it's about prognosis or about, so they know where you're at and what kind of information you want.